So welcome to the Step Learning Collaborative Family and Community Workshop series. Today, we will be discussing strategies for supporting young people with early psychosis, and in particular, we'll be discussing strategies for common scenarios. This training and the series is brought to you by the Step Learning Collaborative in collaboration with support from CT DMIS and CT DCF, along with the STEP program at Yale. I have no conflicts of interest to disclose. So today we'll be covering some brief background on psychosis, and then we'll really try to walk you through some practical developing a shared understanding of stress vulnerability, where we'll talk about the stress bucket analogy. And then Toni and I will be giving you some kind of bullet point tips for communication strategies for common scenarios that come up when supporting a young person experiencing psychosis. And we'll be role-playing some ways of doing things well, as well as some ways of doing things where there could be some improvement. And then lastly, I'll just remind you all of the offerings of the Step Learning Collaborative. All right, so our brief background on psychosis. What is psychosis? So when I say psychosis, I'm not talking about a specific diagnosis per se, but an umbrella term that is the experience of an individual struggling to differentiate what's real from what is not real. And most commonly, psychosis occurs in the context of mental illnesses such as schizophrenia, a schizoaffective disorder. And so within a schizophrenia spectrum disorder, individuals might experience various symptoms of psychosis, which can include disturbances in their sensory perception. So those might be hallucinatory experiences through any sensory modality, whether that's hearing things that others might not hear, seeing things, smelling, tasting, feeling. Folks might come to believe false explanations for their experience and develop some fixed false beliefs, which we might refer to as delusions. And those can take many different forms, ranging from kind of a paranoid type delusion, where folks are feeling that folks are out to get them and has a type of persecutory nature, to other types of delusions, such as feeling like something that could very realistically happen, my partner's cheating on me, to something that's implausible or a bit more bizarre, that my family member has been replaced by a doppelganger or an alien or a clone in some way, right? So there's such a wide range of these symptoms. No two people have the exact same presentation. Other common symptoms might be confused thinking or speech, withdrawing from friends and family, and then you might see a decline, disruption in the individual's social and role functioning. So you might not be aware of what exactly might be going on for your loved one or family member, but you might see the behavioral manifestations of some of these experiences in those functional declines. So that's all we're going to discuss. As I mentioned, feel free to reference other presentations we have on the Step Learning Collaborative website. And now I want to get into developing a shared understanding of stress vulnerability. You might ask yourself, or you might have wondered, okay, what exactly causes psychosis? Why did this happen? And there's no single factor that causes psychosis or schizophrenia, but it's often an interaction between genes and environment, or some type of pre-existing genetic vulnerability and stress. And so that's where the stress vulnerability analogy comes into place. We like to talk about the stress bucket analogy with many of the folks that we work with. And I find this analogy really applicable to both individuals experiencing psychosis, their family members, as well as anyone who's experiencing some type of stress or vulnerability in their life. And so the basics of it are that we're all born with a bucket. We don't get to control how big the bucket is, and I'll talk about factors that might influence that. And basically, when stress pours into our bucket, when it starts to overflow, meaning we're kind of past capacity, that's when whatever symptoms or experiences we're vulnerable to kind of come out. And so for this specific example, we're talking about folks that are vulnerable to psychosis, but it could look a lot of different ways. It could be a manifestation of anxiety, depression, other types of vulnerabilities that folks experience. So that's what I love about this example, is just that it's inherently normalizing, regardless if any of us are experiencing psychosis or not. I think we can kind of all relate to this stress bucket analogy and really partner with the young people that we're caring for to try to help normalize the experience of understanding our stress and vulnerabilities and what we can do to empower ourselves to make changes. As I mentioned, when the bucket starts to overflow, that's when we see the symptoms or behavioral manifestations, our vulnerabilities. And particularly, you might see that come about if someone's got a smaller bucket and no holes to let the stress escape. However, the way we like to lay it out with individuals and family members as well is really walking through what goes into this stress bucket, and then also what we can do to kind of release some stress. So we first start by helping the young person understand what might be impacting the size of their bucket or their vulnerability. And so we might discuss some folks have genetic or family histories of psychosis, or maybe the individual is not comfortable using those words yet or not identifying with their illness. So we just might say that, there's a vulnerability to getting stressed out in this way, or whatever words the young person is using. You can use those words. We might discuss kind of early adverse experiences, early head trauma. And then the big area of focus would be, okay, so everyone's got stressors pouring into their bucket. Some common things that are stressors for folks could include relationships. We know transitions, particularly maybe that transition to college is a time where we might see the burgeoning of a psychotic disorder, experiences of loss, changes or stress in school and work, the use of drugs, finances, discrimination. There's a variety of stressors. And here we also discuss with folks that stressors kind of get the connotation that they're inherently bad. However, there doesn't have to be a balance, or there can be things that have good stress. I often would share with clients, that I love my family, I love my kids, I love my job, but they certainly pour things into my bucket. And so there's ways to manage it. So this doesn't mean if you're identifying something in this area that it's inherently bad. It just might need to be looked at to see if we can modulate the impact of it in some way. So we're talking about the size, we're talking about the stress pouring in, and then I'll talk with the individual. Okay, what does it look like when your bucket starts to get close to the top, or it starts to overflow? And this is where I have in mind, okay, this is where I'm trying to help them identify symptoms or early warning signs. I don't actually care what the individual calls it at this point. If they're saying, oh, when my bucket's overflowed and my psychosis happens, that's helpful, that's great. But 60% of folks experiencing a serious mental illness really don't identify with having a serious mental illness or having psychosis. So again, the language here, you can really be flexible. So maybe they say, oh, when I get super stressed out, or when I get those intense thoughts, and I'm going to use their language with it. So what does it look like when your bucket's overflowing? And they might say, that's when the voices get really intense and start telling me to do things, or I stop going to school, I start getting more angry, or I have a harder time sleeping. And then I might also ask them, okay, and so that's what's going on for you. If I was around you during that time, like what would I see if your bucket was overflowing? What would it look like? And that's another way to help an individual kind of get at, what another early warning sign that a family member might be able to look out for. And so maybe they would say, oh, you know what? My mom's told me that like when I'm like this, I start pacing all over the house, or I start talking really loudly, or she notices I wear my headphones a lot more, or things like that. And this is also an exercise, as I've talked about in past sessions, that you can bring a family member into, or another support person or carer, and say like, okay, Johnny, we've heard from you. Is it okay if we ask mom now, like what she sees when the bucket starts to overflow? And you might even do this exercise with the therapist or a parent or caregiver, also kind of identifying their own stressors and what it looks like when their bucket overflows. Again, all for that kind of normalizing, destigmatizing way to help us start to feel comfortable talking about the stress, the vulnerability, the manifestation, and then ultimately what we can do to poke holes in the bucket or to experience some stress relief. I'll be talking to the individual about, okay, can we limit any of these stressors that are pouring into your bucket? And maybe there's some that we can limit. Maybe we can start going to school part-time and just take a half course load instead of a full course load for a while. But there are some things that are inevitable and we can't avoid, but we can poke holes in the bucket. And so we'll talk with the individual about what are some things that you do that you feel like help you feel better or relieve your stress. We'll start with the individual trying to come up and brainstorm ideas that work for them. And then I might ask permission. Is it, I've been working with you a little while. Is it okay if I offer some observations that I've seen that I think have been helpful for you? You're coming to therapy, you're taking the medication. I wonder if that's something that's, poking holes in your bucket. And it seems like you've been trying to work on your sleep and some of those breathing exercises that we've been working on. And I noticed you told me that talking with some close friends is really helpful for you when you're feeling stressed out. Does that make sense to add that to this part? And so that's a way that you can kind of walk through it. And I share this because, yes, it often happens in a therapeutic setting, but also it's just helpful for family members and support people to have this framework to understand how to understand psychosis. Because even when folks get into treatment and we start treating it, this is a really helpful framework to be able to identify early warning signs, to know, what are some of the things that might be happening, or to help a young person recognize, okay, my psychosis has been well managed for a while now, but wow, I'm like back in school and it's midterms or it's finals And that stress bucket is really reaching the top. So is there a way I can poke some holes in it in other ways so that I don't experience breakthrough symptoms? And just a helpful framework to know that we do have some agency and control in supporting folks and helping them support themselves through experiences of psychosis. So now we wanted to get into strategies for common scenarios. And so I'm going to outline some key bullet points for kind of each of these different scenarios. And all of these are also available on our website as a downloadable tip sheet. And this recording and slide deck will be available too. A select number of these Dr. Gibbs-Dean and I are going to role play for you. We know in folks experiencing psychosis that many folks might have difficulty concentrating, thinking, or remembering. And this might be whether it's a manifestation of some cognitive symptoms, or maybe it's happening because of positive symptoms of psychosis kind of impacting that kind of thought disorder if someone's kind of experiencing acute symptoms. So if you're aware that your loved one might be experiencing this, or you're kind of new to the experiences of psychosis, it can help to keep your statements short. Try to give one message at a time. Try not to give too many choices. It can be really helpful to utilize written reminders or other memory aids. So sticky notes, whether it's remember to take your meds, or even if it's remembering basic self-care things like shower, teeth, backpack, things like that, calendars. Schizophrenia can impact prefrontal cortex and can have impacts on executive functioning. Instead of, so many parents understandably can feel frustrated when they're trying to support their young person. They might feel like their young person's just not trying, or they used to be able to take care of themselves and organize all of these things better. And now all of a sudden they're feeling like, what is going on? Like they're not able to do this anymore, or I'm enabling my child by helping them with all of this executive functioning tasks. But I want you to remember that these areas can be impacted in folks with schizophrenia spectrum disorders. It's okay, and actually even encouraged, to try to help them develop strategies to support that executive functioning. And so you can offer guiding questions. What would the first step be in addressing this problem, or starting your homework, or calling the doctor, or whatever it is? And how would you begin? These are just some strategies to help folks if you're noticing this type of situation with them. An additional scenario. So if your loved one or person you're supporting is expressing delusions, or those fixed false beliefs, and they're 100% convinced, okay? So they're not hearing kind of anything else. They're feeling certain that the FBI is following them, and they're not questioning it at all. So we'd consider that someone kind of fully convicted of the potential delusional belief. We talked about this a lot last session, but just some reminders. We don't want to argue. We certainly don't want to say, you're crazy, that's not happening, right? That's not going to be helpful in this situation. We need to remember to activate that suspended disbelief and accept that this is the individual's reality, kind of what they're saying. It feels so true to them. When you're in this situation, trying to communicate with someone who's expressing delusions, be true to yourself, okay? You don't need to collude or lie, but you might say something like, I can't see them, but I know you can, right? If your loved one's asking you, Mom, don't you see this? Or like, can't you hear that? You can always validate their experience, their underlying emotional content, but we don't have to collude. The biggest thing to take away from this is don't directly confront or argue. Toni and I are going to start doing a couple role play scenarios. So just a little bit of background for our role plays. I want you to keep in mind that I'll be the mom in this scenario. Toni will be the young woman. She's a college student. We know that she's experiencing some paranoia, and she's convinced that someone is monitoring and following her. She also experiences hearing voices telling her to hurt herself before they figure out the truth. She experiences kind of some ideas of reference. So seeing things in her environment that she thinks are specific signs that have special meaning. She also uses cannabis to cope and goes on and off medications, just to kind of give an example of where someone's coming from. This first example is a demonstration of an interaction that doesn't go well, and then we will give an alternative one.
Mom, I can't take this anymore. They're everywhere. They're tracking everything.
Here we go again. No one is tracking you. When are you going to give this up?
You're wrong. You have no idea what you're talking about. They're telling me right now that they know the truth. Can't you hear that?
No one else is here. It's all in your head. You just need to take your medication. As you can imagine, this type of interaction with its increased emotional tone is likely to be perceived as less supportive, lead to more conflict, and increase stress, and even exacerbate symptoms. But remember, as parents and caregivers, we are human, And it can be so challenging supporting and knowing how to respond to someone who's actively experiencing psychosis. So know that this is not an uncommon type of interaction. However, we want to empower you all that you can improve these types of interactions. But don't beat yourself up too much if you feel like you've had that exact conversation or if that comes up time and again. We're just looking for, some improvement. Now we will give you a different version of this same scenario.
Mom, I can't take this anymore. They're everywhere and they're tracking everything.
That seems overwhelming. I imagine it might feel very scary and like an invasion of privacy to feel like you're being tracked.
Yeah, exactly. I feel so exposed. They're telling me right now that they know the truth. Can't you hear that?
You feel really vulnerable. And I can't hear that right now, but I know you can.
Yeah, I hear it loud and clear. I wish it would go away.
You want some relief. Is there anything that can help you feel safe right now? Anything that you think would be helpful?
Oh, I don't know. I can't think.
Would it be okay if I made a suggestion?
I guess.
Maybe we could try to do something distracting, like listen to some music or maybe take the dog out in the backyard. So in this demonstration, you can see the difference, right? The parent calmly validates. So just even that emotional tone is different. They reflect, they utilize that suspended disbelief. So they don't collude with the individual, but they say, I know it's true for you, keeping that emotional temperature cool, invoking some of those strategies that we talked about that helps the young person feel in control, right? So that I ask for permission if I could offer a suggestion, and then ultimately tried to make a suggestion to help relieve stress. Moving on to another but similar scenario. If you're communicating with a young person who's expressing delusions and they've previously been open to discussing them, okay? So this is the difference here is maybe they're not as acutely convinced of their experience, or maybe they're connected with a therapist and you've talked about this before, or they've been willing to kind of have some conversations with you. So you're going to notice that this goes a little bit differently. You might remind them, these are some thoughts that come up sometimes. You've learned to not give these thoughts too much attention. They might utilize you to check out their interpretations. You can ask them, how might that be? How might that happen? Again, kind of utilizing open-ended Socratic questioning. So we'll be kind of pulling from what we use as therapists as kind of CBT or CBT for psychosis strategies, but family members can invoke some of these same tenets to engage with their young person. We're going to give you another example.
This just keeps happening. They're everywhere and they're tracking everything.
That seems overwhelming. I imagine it might feel very scary and like an invasion of privacy to feel like you're being tracked. Am I getting that right?
Yeah, exactly. I feel so exposed and it's distracting.
That must be so uncomfortable. I'm curious, how do you know they were there?
Well, I could see them following me home from the bus stop on my way home from class.
Hmm. Help me understand. What did you see?
A lot of things. The guy across the street kept touching his ear, and there were a couple of red cars in a row. I just had this feeling.
Hmm. That sounds like a lot.
Yeah.
I I just want you to know I just want to understand how this is all affecting you. Is it okay that I'm asking all these questions?
Yeah, it's okay. It's nice actually that you want to know. Sometimes I feel like I'm not supposed to talk about all this stuff.
Well, I really appreciate you sharing with me. I do want to know. I'm curious. What did you make of the guy touching his ear?
Well, it was a sign. He was probably communicating with the red cars or something. I don't know. It just felt like he was in on it.
You felt like it was a sign. I wonder, any chance him touching his ear could have been something else?
Well, like what?
I don't know. I wasn't there, so I can't know for sure. But maybe he had like an itch or was like fixing his headphones, tucking his hair behind his head.
I guess I hadn't thought of all those things. I don't know though. There were all those red cars.
Yeah, just a thought. Thanks for hearing me out. This role play demonstrated a situation in which the young person was not as acutely distressed, as I mentioned, as their first scenario. So the parent's able to calmly validate, and then they're able to start engaging in some of that curious or Socratic questioning that we talked about. Note that the parent asks open-ended questions, right? You're dropping all assumptions. You're just genuinely trying to be curious, both with the way you're asking the questions and your tone. They ask permission and also checked in with the young person, like, hey, is it okay that I'm asking these questions? And then only after a lot of validating and understanding attempts to support the young person, then the parent gently starts to try to generate some alternative explanations, again, which is a CBT for psychosis strategy. And this progressed into a bit more of an advanced interaction. But if you're just starting out, keep in mind, just heavily focus on rebuilding the relationship, and don't be afraid to just stick with reflective statements, validation, and some of those curious and non-judgmental questions. Another common scenario that we talk to a lot of families about, if the person's behavior appears unmotivated or inactive, right? And so you might think that they might be experiencing some negative symptoms of psychosis. They could also be experiencing a comorbid depression or even, some sedating side effects of the medication. But it's important to keep in mind, if your young person's experiencing this, that they're not lazy, right? This is not a lack of will. This is not anyone's fault. It's easy to attribute that, right? Especially if we saw our young person act differently previously and now there's this change. But keeping in mind that background, we know that folks experiencing schizophrenia, some of them might have difficulty with what we call anticipatory pleasure, or like getting excited about things in advance, but not consummatory pleasure, meaning when they're actually experiencing the activity or the event, folks still feel the same kind of amount of pleasure and joy and things that they might otherwise, but it's particularly that anticipation that makes it hard to motivate ourselves, right? If we're not thinking that, oh, a hike might be nice and exciting and the exercise might feel good, or going out to eat might taste good and might be nice, if we're not able to kind of get excited about any of that, then I think it's really understandable that we might not feel as motivated to go do things. This is why, although it can be challenging and tiring, some folks might need a lot of probing and support from their family or loved ones to help them engage in various activities. If this kind of characterizes the individual that you're supporting, remember to encourage pleasant events, simple activities like going for a walk, listening to music, whatever it might be that the person previously enjoyed. Encourage some structure, like a daily routine, and then focus on praise and effort, not necessarily outcome, right? Like, I see you're working hard at trying to get up and get going in the morning, right? We're working on that growth mindset as opposed to only the kind of achieved goals. We want to foster folks' ability to kind of put in effort and know that that's the process is important too. Now, Toni and I will walk through a role play that embodies this scenario. And just to set the stage for this role play, imagine that the young person is struggling to leave their room and just like struggling to kind of get out and engage with family. Hey, just wanted to check in and remind you about our family outing later.
Ugh, I just don't feel up to it. It's too much effort.
You're feeling like it would be too much.
Yeah.
Yeah, I hear you. Well, remember last time we all went up to Sleeping Giant together? Gosh, I just loved how you helped carry your little sister up to the top. That was so sweet and thoughtful of you. It seemed like you really enjoyed yourself.
Yeah. I guess it was a pretty cool view, but I just don't think that this is going to be any fun.
I know it can be hard to get up and do things when you don't feel like it'll be any fun.
Yeah, it really is.
Okay, well, I want you to know we're leaving at 12. We'd all love to have you join. And just keep in mind, if you come and if we get there and you aren't feeling it, you can always head back to the car. In this role play, you can see that the parent attempted to engage and prompt the young person in existing family routines and rituals. So family always goes out for some type of activity together on the weekends. There was the use of reflective statements, also invoking some of that befriending and reminiscing over positive memories, kind of thinking about a previous time when it was enjoyable to go hiking together, but also recognizing potential limits of negative symptoms, as we mentioned. So again, just keeping in mind, it's important to kind of not give up, like continue to offer and invite and encourage your young person to engage, but also you have to ultimately kind of respect their decision of where they're at. And again, keeping in mind that this is not laziness or kind of lack of will, trying to not kind of add that in of like, you're so lazy or thing, because the individual might already be having some of that negative self-talk going on in their own minds. Sometimes folks are interacting with a young person experiencing psychosis and the person's behavior is frightening to the support person. Of course, there's specific things for each scenario, but in general, it's important to give the individual space. You can move gently to a quieter, more open surrounding. We don't always know what's going on internally for someone who might be experiencing a psychosis. You don't want to crowd them or rush them or surprise them. Try to speak and act calmly. Again, keeping in mind those like simple questions and directives, asking what might help. trying to stay calm, communicate simply. If things are frightening, giving a clear directive, stop, please, to try to de-escalate the situation. If there are some known warning signs of a relapse, maybe you all have kind of worked on that stress bucket, kind of relapse prevention activity together where you've identified what early warning signs look like and they're aware, you might let them know that you're seeking help for them. Maybe you're going to contact their therapist or initiate an emergency response if that's required, or do whatever it is that might be on kind of individual relapse prevention plan. And also it's important that if they do occur, to take threats seriously and get help by calling for support. Here are some phrases that you might use if you're trying to navigate an intense interaction. And some of these, again, the intense can be defined a variety of different ways. Can just be, a heated debate where there's a lot of disagreement, or there can be a situation where things are starting to feel unsafe. You might reflect, these thoughts, feelings, experiences are really intense. I'm wondering if we should try to focus on something else for a little bit. Right there, you're taking an example of, okay, can I distract away from this situation, right? Maybe you use some of that Socratic or curious questioning and it didn't go well. The person started feeling upset or attacked or interrogated. And so you can backpedal, right? And you can just reflect. You don't have to keep pushing. You can reflect this and ask if it's okay to do something else or take some space. You can always control your own actions in these situations. So you can state, I feel like I'm making things worse or more difficult right now, so I'm going to step away. I'm noticing we're both really upset right now. Let's come back to this later. I know some of these might feel simple, but sometimes in those moments we freeze, or we don't know what to say. Seems like you've already made up your mind about what you're going to do. Good old agree to disagree. And then if things, as I mentioned, are starting to feel unsafe, you might say, I'm concerned about your safety. I'm going to go get help. So leading to that situation where things have escalated, or you're in a situation where you're supporting someone and you're feeling like, okay, I think we need some help from first responders due to some type of acute safety issue. And so for this, please know that each situation is individual. We have resources on our website. If you're working with a treatment team, it makes sense to talk with them specifically about when to kind of call 911. In general, we would call 911 for kind of an immediate kind of life-threatening response or safety concern. And then you might activate 988 or 211 if there's not an immediate safety concern, but there is a mental health crisis going on and you're in need of support and kind of hoping for some type of mobile evaluation. So here I'm giving the example of saying 911, but kind of keep in mind that some of these scripts can kind of work for really call any of the emergency response teams. Things to keep in mind: if you're calling 911, it's helpful to say to the operator that the call is regarding a mental health crisis and that you need assistance. If your family member or support person you're supporting has a diagnosis, let them know. Okay, by making sure that the people that are responding to them are aware of their diagnosis. You're not kind of protecting them by withholding that information, or even if it's not an official diagnosis, you can describe the type of symptoms and behaviors that the individual is displaying. But the more information that the dispatcher has, the more informed the response team can be and can really help a crisis situation go more smoothly. If appropriate, you can, as I said, it's not like a immediate life-threatening call, be maybe someone has actually taken an act to hurt themselves or to hurt someone else, or that feels like it's imminent, that's a 911 call. But if a mobile crisis response team, that would include a mobile crisis clinician who could come out and evaluate someone, you could request that to come to your home in addition to the police. When speaking with the operator, as I mentioned, try to give as much information, pertinent information about your family member, about their kind of history, any prior contact with the law, or any concerns you have about the situation. And unfortunately, you're going to need to be prepared to repeat some of this information once police or other first responders arrive on scene. Something that I, do want to mention, it's helpful to let them, know like if there's any weapons in the home, or if the individual currently has access to any weapons or firearms. Of course, anything can be interpreted as a weapon, but trying to kind of inform and kind of get ahead of the situation is important. And if, you're so concerned about your own safety in these situations and you need to vacate the premises, try to stay close enough that when first responders come, you can still identify yourselves and speak with folks when they arrive to help support the situation. This, as I mentioned, these situations are so nuanced, and we actually hope to have a full kind of family workshop and panel just about this topic, about navigating crises in the community related to individuals experiencing psychosis. So this is just a quick primer, and Certainly, it's important to consider racial and cultural factors in this. We know that there's racialized violence in our country, and that, sometimes responses that are well-intentioned, of a parent or family member reaching out for help, we wouldn't want that to go awry. So I understand that there's a lot of considerations, and it's not just an easy thing to do to kind of pick up the phone and call 911 and invite first responders into our home or into our community in the greater context of our country. So kind of keeping those things in mind, sharing, that's why it's helpful to kind of share as much information as you can, share information about prior contact, about any history of aggression, about access to weapons. And then just, certainly there are efforts in our state, and the Step Learning Collaborative is also working actively with officers and the organizations that train officers to try to help folks that are responding in these situations better understand first episode psychosis. So with all that being said, I will try to walk you through what a potential example phone call might look like. I'm going to pretend I'm a parent calling an emergency number. Hi, this is Laura Sykes. I live at 34 Park Street. My daughter is currently experiencing a mental health crisis, and we're requesting assistance. She has a diagnosis of schizophrenia and is currently unmedicated. She's currently very paranoid, and she's actively hearing voices that are telling her to hurt herself. Right now, she's pacing back and forth inside of our house. I'm really concerned for her safety. She won't let me take her to the hospital. Is there a mobile crisis team and/or a CIT officer that's available to come to the home to evaluate her? She does not have any type of weapons on her, and there are no weapons or firearms in the home. She has no history of aggression. So that is an example of what that might look like. I'm trying to be clear. This is a mental health crisis. I need help. I'm giving pertinent information about psychiatric diagnoses. I'm describing concretely the behavior, right? Mentioning the paranoia, the actively hearing voices, behaviorally pacing, and then trying to talk about other information that might be pertinent to help the officers and team when they arrive on the scene. So that is it for the common scenarios. Now I just want to quickly remind folks of some of the offerings of the Step Learning Collaborative. So for those of you who aren't familiar with the Step Learning Collaborative, as I mentioned, it's a collaboration between the STEP program at Yale, Department of Mental Health and Addiction Services, and Connecticut DCF. We have developed a network of care for early psychosis across Connecticut by partnering with the 13 local mental health authorities, which make up 20 plus clinical sites. We are offering a centralized referral line, which you can see right here, that anyone, whether it be an individual experiencing psychosis or a family member who's concerned about them or another community member who's concerned about them, you call our line, and it's for individuals that are between 16 and 35. They must live in Connecticut or have experienced symptoms of psychosis within approximately the last 3 years. And to be part of the initiative, they do need to be English speaking, although we can connect folks to care if they are not English speaking as well. The goal is to try to rapidly connect folks to care across the state. No matter what zip code they're in, we want some people to know that there's access to care in an area near them, and they can call the number to kind of help with that. Upon calling the number, they'll be connected with one of our early detection and assessment coordinators. They'll call back, so such as Dr. Gibbs-Dean or the other 4 EDACs. They'll quickly try to understand what's going on for the individual, rapidly screen for eligibility, and then if the individual's eligible and willing, we'll immediately connect them to one of the referral sites based on where they live. Additional things that the Step Learning Collaborative offers, as you all are right here, this is one of the family and community workshops. And so we're offering those to try to educate and support the community. We also offer regular provider trainings, which all are welcome to. You don't have to be a provider. And the past recordings of all of these are available on our website. We're also trying to, support care at these referral sites for our network by offering a consultation line that is free provider to provider consultation. So any provider in Connecticut, they don't have to be part of that 20 site network. They can put in a request and get a response back within a day or so to have a conversation with expert early psychosis clinicians, psychiatrists, caseworkers, whatever the need is. And then there's various courses and virtual resources available on our website. All right, and so if you haven't already, you're welcome to go to our website, mindmapct.org. We encourage you to join our newsletter kind of email list. It's just a once a month email blast that kind of gives you all the updates and reminds you of any trainings or offerings or kind of community outreach or events that we're engaging in that we'd love for you to join us in. And of course, anyone who's looking to connect someone to care, even if you are a provider, you can call that centralized referral number. Thank you.